So we've heard some people talk about the online environment as Siberia, this really dark and desolate place where young people get themselves into nothing but trouble. People throw around words like cyber suicide, so highlighting cases of individuals who may have taken their own lives as a result of engaging with technologies or meeting people online. There are certainly individual cases documented, but it's probably important to bear in mind that while access to technologies has increased, particularly young people's use of social media, we've seen the overall rate of youth suicide decline quite steadily. Again, it's one of those things that you view in context. You know, any death by suicide is a tragedy, but it's about viewing some of this information in a sort of broader context. And acknowledging that suicide is complex. It's incredibly complex. People often talk about the risk of contagion, and this is something that comes up a lot when we talk to mental health professionals and clinicians around the role of technology. Contagion being the idea that people might read or see suicidal behaviour or ideation online and actually start engaging in that behaviour themselves. Certainly in online communities and on social media, it's a real risk and something that a lot of mental health services have invested a lot of time and energy into being able to manage to ensure that people who are engaging with online services and communities experience that in a really positive way. Cyberbullying, as I said before, is again a real risk, but that we need some better research to better understand prevalence and the way in which online and offline victimisation interact. And then we also hear about this growing problem of internet addiction. The literature is growing around this. It predominantly comes from Southeast Asia. There's been an anecdotal increase in clinical presentations, but certainly nothing to suggest that it's reached really, I guess, worrying or significant proportions. So I guess to put it back in the context of young people's views around cyber safety and cyberbullying, I'm drawing on some work that was conducted by the Inspire Foundation, probably going back about 2.5 years ago, and used to inform their contribution to a number of policy statements around cyberbullying and cyber safety. In talking to young people, they found that cyberbullying and harassment was certainly a key risk area for young people. It was something that young people felt was of concern. But unfortunately, a lot of the existing programs designed to tackle cyber safety actually focus on a really restrictive approach. So it might be about putting filters in place to prevent young people from accessing particular content or having particular types of content sent to them. It might actually be about removing young people from the online environment as a way of actually reducing some of the risks. So it's about actually reducing young people's engagement with the risk as opposed to supporting young people to develop skills and strategies to be able to manage some of those risks for themselves. Very few resources adequately address issues around cyberbullying, although we're certainly seeing an increase in the availability of good quality resources, and I can show you a few of those in a moment. And a really significant number of young people who participated in some of the focus group discussions that Inspire ran found that they actually had really high levels of awareness around online safety. And when you talk to young people about the type of information they share online, they were quite keen to, I guess, assure people that they were aware of how to reduce some of the risks online. So things like school students not actually posting which school they were from on their Facebook profile, or setting profiles to limited access so that they were very clear about who they shared particular types of information with and which information they kept private or just to themselves. We know from our engagement with young people that approaches that are based on restriction are often considered by young people to be quite easy to get around, to circumvent. And this was particularly the case in schools where access to social media was often blocked. It's the same in a lot of health services where access to sites like YouTube or Facebook or Twitter are actually restricted. What they actually found was that young people were quite clever in gaining access to other online networks to be able to engage with these services. What these restrictive approaches did do, though, was actually discourage young people from being able to discuss online safety issues in a really open way and to actually report problems when they came up. So rather than feeling comfortable going to a teacher or a health worker or a parent and saying, look, this is what's happening to me online, I'm a bit worried about it, I need a bit of help and support, young people were actually less likely to engage in those conversations because they were really worried that if they did so, their mobile phone would be confiscated or they'd have restricted access to it. They wouldn't necessarily have access to the social networks they had access to before. So what that really demonstrates to us is the importance of being able to give young people the skills and the strategies to be able to engage with technologies in a way that allows them to be safe, but also in a way that isn't detrimental to their mental health and wellbeing. And young people felt that oftentimes the types of strategies that were put in place to support young people to stay safe online didn't really reflect their day-to-day experience, and that meant that they really lacked a bit of credibility. So just to, I guess, finish off this train of thought around how you actually keep young people safe online and minimise risk, as Hugh goes to the next slide for me, is that young people were much less responsive, as I said before, to approaches that limited their access or advised against interacting with people online. It's really important that whatever engagement we do with young people around their technology use recognises their own agency and their own ability to be able to navigate the online environment, and that actually the benefits of using technology in a lot of cases can outweigh some of the negatives, and so we've got to view it all in a little bit of context again. I think context is probably the key take-home message from the content that I'm presenting to you tonight, that it is about actually viewing all of these behaviours, all of these risks and all of these experiences within the much broader context of young people's lives. Yeah. Yeah.
Because they haven't backed up on it, might put out a particular article or story, it's not backed up by evidence.
Yeah, so we often see the extremes. And I know, for example, that when you talk to police around cyberbullying or about sexting or any of these things, they often only see the ones that are at the most extreme end that have actually made it to the report stage. They don't sort of see any of this stuff within the broader spectrum of behaviours or within the broader spectrum of what's actually going on for young people. So you do only ever see the really positive or the really negative, and not the 80% of what happens online, which is actually generally okay and positive and, you know, not health demoting in any way. Yeah, it's a really valid point, I think. So I guess onto the good news, and this is where you hear all the glowing, fabulous stuff about the internet and how wonderful it is for young people. What we have seen, particularly in the context of mental health, is that the growth in the accessibility of online services has meant some fabulous advances for people who often wouldn't have had the opportunity to seek help face-to-face or wouldn't have been in a position to because of a variety of different barriers. So we know, for example, that the delivery of information online around mental health issues whether that be through recognised government or not-for-profit run websites, or whether it be through people's engagement with social media, can actually lead to people becoming much more informed health consumers, can increase their mental health literacy, and in turn that can actually promote early help seeking. So oftentimes in the past, when a young person's been really apprehensive about seeking help, they've really only had maybe their immediate geographic peer group to draw on, or their parents or people in the community. What the online environment has meant is that young people can actually go to a number of different sources for information about what they're experiencing, to be able to find out more about the issue and make a more informed choice around seeking help. I guess in turn that can mean that young people are actually seeking the help that they need a lot quicker. So there's some data to suggest that there's actually, in a lot of cases, a period of delay of up to 10 years between someone first experiencing the symptoms of a mental health difficulty and actually getting appropriate help and support. So they might try a couple of different places, might not work out for them the first couple of times, so they need to keep trying. But hopefully by actually supporting people to develop really good mental health literacy and a really good awareness of who can help and in what circumstances, we can actually direct people in a much more appropriate way. We also know that online communities can help to build social capital. So they can give people the resources that they need to be able to draw on when times are tough. And that's particularly the case, I think, for young people and for the general community in rural and regional areas, or from particular interest groups in the community. And I think Bryony can probably talk quite well to the experience that people have had of being able to connect via Twitter around rural mental health issues. You know, there's a really, really strong community of people out there who are being able to provide mutual support to each other and also to advocate around the issues for people in rural and regional Australia. There's also, I think, enormous opportunities to use technologies to improve the service system. So probably a really good example is the work that the Inspire Foundation's done around their reachout.com service, which is a website for young people aged 14 to 25, which provides them with information and resources to help them to manage their own mental health and connect them to help and support when they need it. Reach Out's been going in Australia for about 13 years now, and also operates in the United States and in Ireland. And I think one of the really fantastic things about the Reach Out service is that it's created opportunities for young people to share their own stories in a way that reassures others that they're not the only one having this experience, and that there are people like them from similar backgrounds and with similar stories, and that can often reassure people that they're not alone and that they're not possibly as isolated as they feel. There's also a whole body of evidence, which I won't go into tonight, which is around the role of technologies in a clinical context. There are some really fantastic online resources out there like Mood Gym, like Virtual Clinic, and Reach Out Central, that allow people to be able to work through online modules. There's some really great ones for depression, for anxiety. There's a great service under trial by Swinburne University called Bulimia Online, for young people with eating, or for people with eating disorders, and a whole series of services around panic disorder as well. So lots of really fantastic resources.